How should a social worker prioritize interventions for a client experiencing severe PTSD and substance abuse? A. Address the substance abuse first, as it may interfere with PTSD treatment by impeding emotional processing. B. Treat the PTSD initially to potentially reduce triggers that exacerbate substance use. C. Begin with psychoeducation and stabilizing interventions that address both conditions. D. Assess which condition presents a greater immediate risk to the client's safety and well-being and prioritize accordingly. Answer D. Assess which condition presents a greater immediate risk to the client's safety and well-being and prioritize accordingly. Prioritizing treatment based on the immediate risk to the client's safety and well-being allows the social worker to address the most pressing issues first, whether it's the risk of harm from substance use or severe PTSD symptoms. This approach is vital for ensuring that treatment addresses the most critical aspects of both conditions in a manner that enhances overall safety and stability. In planning treatment for a client with bipolar disorder, what is crucial to consider for effective medication management? A. The client's history of medication adherence and its impacts. B. The potential side effects that might affect the client's quality of life. C. The client's insights and preferences regarding their medication options. D. The likelihood of the medication interfering with other treatments. Answer C. The client's insights and preferences regarding their medication options. Involving the client in the decision-making process regarding medications ensures that they are more likely to adhere to the treatment plan. This approach respects the client's autonomy and ensures that treatment aligns with their preferences and concerns, enhancing both compliance and effectiveness. What should be assessed when developing a treatment plan for an elderly client showing early signs of dementia? A. Cognitive decline's impact on the client's daily functioning and independence. B. The availability and willingness of family support for caregiving. C. The client's previous and current mental health treatments and their outcomes. D. The client's ability to safely manage medication independently. Answer A. Cognitive decline's impact on the client's daily functioning and independence. Focusing on how cognitive decline affects daily functioning and independence helps tailor interventions that maximize the client's ability to maintain as much independence as possible. This focus is crucial for treatment planning as it directly addresses the primary impacts of dementia on the client's life. What is crucial to consider about the client's work environment when planning treatment for an anxiety disorder? A. The specific stressors in the client's job that may exacerbate anxiety symptoms. B. How the client's interactions with coworkers might be impacting their anxiety. C. The type of support and accommodations the workplace can provide to ease anxiety. D. The client's current workload and its correlation with anxiety levels. Answer D. The client's current workload and its correlation with anxiety levels. Understanding the relationship between workload and anxiety levels can provide critical insights into environmental triggers that exacerbate the disorder. This understanding helps tailor interventions that can effectively reduce anxiety by addressing or modifying workload-related stressors. What factor is critical to evaluate during the assessment phase for a client with chronic pain? A. The psychological aspects that may be intensifying the pain experience. B. The efficacy and outcomes of previous pain management techniques used by the client. C. Issues surrounding dependency on medications previously used for managing pain. D. The role of the client's lifestyle choices in the management of their pain. Answer: A, the psychological aspects that may be intensifying the pain experience. Chronic pain is often influenced by psychological factors, and evaluating these can provide critical insights for effective pain management. Understanding psychological influences helps in designing interventions that address both the physical and emotional components of pain.
Hey, let's take a break. I know you've been grinding for hours, which might actually be hurting your ability to retain information. Yeah, science says so. So here's a reminder. Step away for a minute. But wait, you know that I got tools designed to help you study smarter? I'm talking about my 150 question online practice exam so you can test yourself before the real thing, and my 150 social work practice question ebook, as well as my exclusive activity e-workbook that makes studying interactive instead of just reading notes. Because let's be real, just reading the material isn't enough. You need to know how to apply it. So while you're taking that much needed break, check them out. Your future licensed self will thank you. Links are in the description. Now go take that break.
For a client struggling with grief after the loss of a spouse, which assessment tool would best aid in planning appropriate interventions? A, tools that measure the stages and intensity of grief. B, instruments that gauge the client's resilience and coping mechanisms. C, tools assessing the quality and availability of the client's social support network. D, questionnaires that evaluate changes in the client's daily functioning post-loss. Answer: A, tools that measure the stages and intensity of grief. Utilizing tools that specifically measure the stages and intensity of grief can provide detailed insights into the client's emotional state and progression through the grieving process. This targeted assessment is essential for tailoring interventions that are sensitive to the client's current stage of grief. When creating a treatment plan for a client with major depressive disorder, what should be emphasized to enhance treatment adherence? A, ensuring the client fully understands and agrees with the diagnostic assessment. B, integrating feedback mechanisms to adjust the plan based on the client's experiences. C, identifying and planning for potential barriers to treatment adherence. D, aligning treatment methods with the client's lifestyle and preferences. Answer: B, integrating feedback mechanisms to adjust the plan based on the client's experiences. Incorporating ongoing feedback mechanisms into the treatment plan allows for adjustments based on the client's experiences and responses to treatment. This adaptive approach ensures that the treatment remains relevant and effective, promoting greater adherence and better outcomes. A social worker is evaluating a young adult client who exhibits signs of high-functioning autism. The client struggles with social interactions and rigid routines, but has not been previously diagnosed. What should be the initial focus of the assessment to confirm the diagnosis? A, evaluate the client's cognitive and language development history. B, assess the client's current social interaction patterns and adaptability to change. C, conduct a family interview to understand genetic predispositions. D, observe the client in various social settings to evaluate adaptive behaviors. Answer: B, assess the client's current social interaction patterns and adaptability to change. For an adult potentially on the autism spectrum, focusing on their ability to engage in and adapt during social interactions, along with their responses to changes in routine, provides critical insights. This approach addresses core characteristics of autism spectrum disorders, such as challenges with social communication and restrictive repetitive behaviors, offering direct evidence needed for an accurate diagnosis. In planning interventions for a client diagnosed with post-traumatic stress disorder, PTSD, who has a history of multiple traumatic events, what is crucial to consider to effectively address the complexity of the client's experiences? A, Implement a phased approach starting with stabilization techniques before processing trauma. B. Prioritize exposure therapy to confront traumatic memories and reduce avoidance behaviors. C. Use a combination of pharmacotherapy and cognitive processing therapy from the onset. D. Focus primarily on building the client's resilience through strength-based counseling. Answer: A. Implement a phased approach starting with stabilization techniques before processing trauma. For clients with complex PTSD resulting from multiple traumatic events, a phased treatment approach is essential. Starting with stabilization techniques, e.g., emotional regulation and safety planning, ensures the client develops the necessary coping skills to manage distress before moving on to more intensive trauma processing therapies. This methodical progression is critical to prevent re-traumatization and to build a foundation for effective long-term recovery. I hope you found this video super enlightening and a big boost for your understanding of the social work license exam questions. If you're craving more tools and support to ace that exam, don't miss out. Head over to our website at gilbertandbell.com right now. I've got everything you need, from in-depth study sessions to practice exams, all designed to help you cross the finish line and get your license. And hey, if you're on the go, just shoot a quick text with the word study to 347-683-37923. Hurry, these resources won't study themselves.